Hi beauties, welcome back to my channel. In case you're new, my name is Bertha Leonard and this is your official Hyaluron Pen channel. Today I want to just chat about Hyaluron Pen complications, risks, and what is the worst that can happen with the Hyaluron Pen. Please know that there's no such thing as a risk-free treatment. There's always going to be that possibility, so just bear that in mind while we go through the next information. To try and keep this simple, I want to divide this into two categories. One is realistic complications. Those are the type of complications that need to be expected with the treatment, familiarize yourself with them, and know what to do, how to identify them, and how to try and prevent them, etc. Then the second category is unrealistic complications. These are complications that are virtually impossible. These are complications that you'll hopefully and most likely never come across in your whole career. Okay, let's start with minor bruising, swelling, and erythema. These are definitely expected risks or complications, and during your consultation you can identify whether or not your client is a good candidate for Hyaluron Pen treatment. Obviously not everybody is. Factors including health, medication, lifestyle, desired outcome, those are all things that need to be considered before deciding that Hyaluron Pen treatment is a good option for your client. There are factors like supplements and medication that they might be taking, fish oils, for example. They could have a disorder that reduces the body's ability to clot blood, like hemophilia. They could be on medication or anticoagulant medication like aspirin. So there are different things that need to be considered before deciding to do this treatment, because those factors would influence how much bruising and swelling could take place during or after your treatment. There are preventative measures that you can take and things that you can do to help reduce the swelling and bruising. So for example, natural arnica tablets for a client to take that pre and post to treatment will definitely assist in the bruising and swelling. Applying a cold pack to the area immediately after the treatment will also help reduce swelling and bruising. So minor bruising, swelling, and erythema are to be expected. You also get hematoma, which is more of an unrealistic complication. This is something that I think I've maybe seen twice in about a 1.5 to 2 year period, and it's only because I'm in contact with practitioners all around the world. It's not something that I've ever seen in the South African clinics. So it's definitely an unrealistic complication, but it's also a type of a bruise. It's a bruise, but the tissue enlarges due to a leaking blood vessel. So this can be very scary if you don't know to expect it, or you don't know that it is a possibility and that it can happen. And that's definitely one of the reasons why having a trainer is a very good thing, because it gives you peace of mind that if something like this happens and you are unsure of, oh my gosh, is this normal? Is this not normal? What could cause this? Then at least you have a trainer who can help guide you through the process. Hypersensitivity. So hyaluronic acid is not a substance that you'll ever be allergic to because it is naturally occurring within your body. But there are other substances and factors that clients can have allergic reactions to following a Hyaluron Pen treatment. So for example, anesthetics, so your lidocaines and your numbing creams, clients can definitely be allergic or sensitive towards those. And of course you get cheap fillers, so you get cheap version of everything in this world. And with the cheap filler, we have found situations or scenarios where the clients are having reactions to substances like silicone found in the fillers. So hypersensitivity can obviously also be acute or delayed, so it's not necessarily that you're going to immediately see the response. It might happen weeks later. Okay, then another realistic complication that we can chat about is the Tyndall Effect. That is when you can see a bluish tinge on the lip underneath the skin. So that is often happening when hyaluronic acid is placed incorrectly, mostly superficially. That can either resolve itself within 24 hours, or you can let the body leave it and the body will break up the hyaluronic acid on its own time, should you not want to have it dissolved with hyaluronidase. And then of course we have infection. The risk of infection is impossible to eliminate out of most scenarios. Infections occur everywhere. They occur in ICU wards, in dental clinics, and salons. It's impossible to completely eliminate the risk of infection, but you need to make sure that you're well educated on all of the safety and sanitation protocols, that you implement only the most strict hygiene measures. You can't put a price on hygiene, so it's worth updating your knowledge and doing refresher courses on safety, sanitation, sterilization, disinfection on a regular basis. Okay, then we can talk about fever blisters or cold sores. Fever blisters can, if you are prone to fever blisters, then any trauma to the area, even if your immune system is just really low, then you can get an outbreak. It could trigger an outbreak. So we would normally recommend that our clients go to a pharmacy or a health store and get an antiviral over the counter and use it 1 to 2 weeks prior to their appointment. That'll help suppress the virus, and you will be less likely to get an outbreak. Okay. Then the final realistic complication that I would like us to chat about is lumps and bumps. I'm not going to go through this in depth because I've got an entire video dedicated to this topic on my channel, but it's quite a common issue with the Hyaluron Pen because of how superficial our application is. So if you're using the incorrect technique or the incorrect hyaluronic acid, then it becomes a increased risk or a more common issue. Very few fillers are made to be used in the superficial papillary dermal layer, which is pretty much as deep as our device can go. Just before we discuss the unrealistic complications that can occur, let's just quickly recap. Minor bruising, swelling, and erythema to be expected. Hypersensitivity only going to occur if you're using other substances or if other substances are also involved. Infection is a risk impossible to eliminate out of every scenario, but it can most definitely easily be minimized with the right education and implementing hygiene protocols. Fever blisters, if you're prone to fever blisters, just go get an antiviral over the counter. It's a natural product. The Tyndall Effect and lumps and bumps. This is the more common issue that we're dealing with, and it is because of the superficial nature of the Hyaluron Pen. And now let's talk about vascular occlusion. This can lead to horrible side effects like skin necrosis and blindness. Is it possible to cause vascular occlusion with the Hyaluron Pen? Before I answer that, let's just look at what is vascular occlusion. Vascular occlusion is when a high viscosity dermal filler is injected into the deep dermis and into an artery or around an artery to the point where blood flow is reduced or stopped. The area of skin or tissue that is being supplied by the blood vessel will start to die off without the needed blood supply. How would you recognize vascular occlusion? So even if it is only suspected, it should definitely be treated as a matter of urgency. You will almost always see blanching of the area where the blood flow has been restricted. Pain is usually associated with vascular occlusion, and it could happen immediately following your procedure or within 12, max 24 hours. If no treatment is initiated, then the area will turn like a bluish gray color well beyond the site of injection, and after more time has passed, the area will turn black as the skin is dying off. To treat it, you need to inject the enzyme called hyaluronidase, preferably into the vessel or even just into the area. This will dissolve the hyaluronic acid and restore the blood flow. A few other smaller items that can assist are massaging, hot compress, and taking blood thinners. Obviously, your client's safety is obviously always going to be your main concern. Okay, so let's just put this into perspective quickly, shall we? Okay, so we've just mentioned what causes vascular occlusion. So I would need to deposit a substantial amount of a high viscosity filler into the deep dermal layers, so through many layers of skin, and break the wall of an artery. Okay, so that would be at least 15 shots of 0.02 with a high viscosity filler without any product loss or dispersion taking place underneath the skin, as the Hyaluron Pen does, right on top of one another as well, because I'd need to build up the volume. So 15 shots on top of one another, 0.02 mils per shot. Obviously, that's what we normally use. And we'd have to completely neglect to massage the area after. Okay, so my first problem with that scenario is depth. We're working with the Hyaluron Pen. A Hyaluron Pen that has a PSI of about 95. And didn't we just mention that with the realistic complications, the issue lies with the superficial nature of the device? This device lacks the capabilities to reach deep dermal layers. It only has so much penetration. I think that there's a lot of confusion between jet injectors and Hyaluron pens. A jet injector, which is used for vaccinations and insulin, they have a PSI of 2,000 to 5,000. My Hyaluron Pen has a PSI of 95. 2,000 to 5,000 PSI, 95 PSI. Okay, superficial papillary dermal layer. Now, I can't obviously speak for all pens in the whole world because I don't know how all of the pressurizing works on the different devices. Obviously, you can just ask your supplier what is the PSI of the device, because a jet injector can most definitely cause vascular occlusion if it is used to try and inject a filler, which would not be the smartest thing that you could ever do. And also that, again, has a PSI of 2,000 to 5,000. It is for intramuscular penetration. This is for superficial papillary dermal layer penetration. So now let's look at how the pen actually injects the product. To create occlusion or compression of a vein or artery, we need a density, we need volume, we need a concentration of product. The Hyaluron Pen doesn't disperse the product in a solid stream, a concentrated stream. It disperses the product in a spray-like motion, like little scattered particles of product. That's how the Hyaluron Pen disperses the product. The Hyaluron Pen cannot create a big pocket of volume and density of product. That's why the Hyaluron Pen cannot compete with an injectable with regards to creating projection, chin augmentation, jawline augmentation. That projection is lacking because we're unable to use such high viscosity fillers, and because of how it disperses the product. It's spray motion, like a spray motion, if I can put it that way. It's not like a stream of solid concentrated product. So even if I turn my pen to 0.04, I'm now going to have a bigger shot. This I will never do on, I would never use this on a lip area. It's too big a shot. But even now, it's more product, but it's still going to be dispersed in a scatter formation, not in a bolus injection. So to conclude, to my knowledge, and I have done a tremendous amount of research, there has been 0 reported cases of vascular occlusion being caused by the Hyaluron Pen with evidence to back it up. I've had 1 or 2 people say that it's happened, and as soon as I ask them, oh my gosh, who did it happen to, or where did it happen, or just give me any kind of information, then they're like, okay, I'll look for it, or I heard about it, it was a story that I found on social media, or it was a friend of a friend of a friend. I'm sorry, if you're gonna say that the Hyaluron Pen caused vascular occlusion, you need to be able to back it up, because that really goes against a lot of basic facts of Hyaluron Pen. So if you follow basic rules, you understand how the treatment works, you use the correct products that are made for use with the Hyaluron Pen, then no, you're not going to cause vascular occlusion. The Hyaluron Pen shouldn't really be competing with injectables. It is a very beautiful treatment. I absolutely love it and I love the results. But upon a consultation, I'll very often tell a client, you're looking for something that I can't achieve with the Hyaluron Pen. Rather, you invest your money in getting injectables. Many clients are terrified of needles and don't want injectables. They trust me. They've been clients of my clinic for how many years. They want me to do a treatment on them. Or they want a more natural result. So they're scared of needles, they don't like pain, they want a more natural result. Maybe they just want to introduce themselves to the treatment, and then they'll decide if they're ready for injectables or not. They want their treatments done with me, then absolutely. The Hyaluron Pen is definitely going to be your ultimate solution. It's really an amazing treatment, it's an amazing product. But it cannot do what injectables can do. The two really shouldn't be competing with one another. They're 2 very different treatments and they belong in 2 very different worlds. So just keep that in mind with the Hyaluron Pen. Okay, so I really hope that you found this helpful. If you're still watching, well done. You obviously really care about this topic and I really appreciate that. If you learned something new, if you enjoyed this, please like, comment, share, subscribe. I really appreciate every single subscription. I'm almost on 1,000. I'm so excited. So anyway, I really do hope that this has given you a little bit of clarity. It is a question that I'm asked almost on a daily basis, which is why I thought, let me just make a video on it. It really is something that it's very hard for me to just say, no, it's not possible, or yes, it is possible. You have to understand the treatment and how it works and how the actual pen operates, what are you using in the pen, and then you can understand why vascular occlusion is not going to happen with this device. But you also need to understand all the other complications that are involved with the Hyaluron Pen procedure, because being able to identify something and prepare your client for it changes the game completely. So I hope that this has given you some more confidence to go ahead and do your Hyaluron Pen procedures. I love this procedure so much, and I really hope that I'm just able to share some of that with you. So thank you so much for watching. Please comment, please subscribe, please like my channel, please share it with anyone who may benefit from it. Thank you so much. Okay, so for those of you who are still watching, here's a little experiment that, well, I did quite a lot of experiments, but I thought let me just add at least one or two into this clip, just to also help just reiterate the point of how the Hyaluron Pen disperses the hyaluronic acid, because it's so important that you just understand that factor. So the diameter is about 0.17, the whole of the ampule that disperses the hyaluronic acid, but look how wide the product is dispersed. And now again, a banana does not resemble skin, but there you can see how the product is dispersed with the Hyaluron Pen versus a needle. So when I use a needle, I have great control. I can create beautiful projection. I can really sculpt to create something very specific. I have really good control. I don't have that with the Hyaluron Pen, which is why there is a difference in the results that you can achieve using an injection and using the Hyaluron Pen, which is why the treatments are not the same. My Hyaluron Pen creates the most beautiful, natural, plump lips, skin, great for mesotherapy. I love my Hyaluron Pen, absolutely love the results as well. And there you can see again, the injection creates that volume, that concentration of product that the Hyaluron Pen cannot create. So again, I know the banana isn't anything like skin, but it is a really great way to test your device if you are ever in doubt. Here I was just using shots of 0.02, and I was using a medium viscosity filler. It was one that was close to expiring, so I thought I would just use it for, well, playing and experimenting. So yeah, hope that this helps as well. Just again, elaborate the point of vascular occlusion being, yeah, for the Hyaluron Pen to create vascular occlusion, so much must go wrong and so many rules must be broken, and devices like jet injectors must be used. It's really something that would take a miracle to happen with the Hyaluron Pen.